Today I am going to discuss with you Internal Medicine 1.7 Competency Based Medical Education. The topic is enumerate, describe, and discuss the factors that exacerbate heart failure. Precipitating factors for heart failure or decompensation of heart failure is important. We know that a patient with heart failure has got an underlying disease like coronary disease, hypertension, cardiomyopathy. But the exact event or worsening of the cardiac failure or decompensation is due to precipitating factors. So today we'll be discussing about the precipitating factors. First and foremost, coronary artery disease presenting with new onset of ischemia. Clinical and electrocardiographic signs of ischemia can lead to acute worsening of heart failure. So there need not be clinical findings. Only ECG findings may be there. Timely assessment of ischemia is essential for management of heart failure. In addition, heart failure, the ischemic symptoms may not be there. Ischemia may be presenting as breathlessness. So it is always important to remember coronary ischemia as a precipitating factor for the heart failure. Second important point is arrhythmias. Arrhythmia can be induced by ischemia, electrical imbalance, for various reasons. Atrial fibrillation with rapid ventricular response, especially when more than 110, can lead to heart failure. Other arrhythmias like ventricular tachycardia can also lead on to. Arrhythmias can worsen heart failure by increasing the oxygen demand of the heart, or it may, for example, atrial fibrillation, the atrial kick is lost and the filling of ventricle is impaired. So prompt management of arrhythmia is important. So when a patient comes to casualty with worsening breathlessness, always important to look for whether this was precipitated by an arrhythmia. Third important cause is respiratory infection or any infection for that matter. Infections such as pneumonia or bronchitis occurring in a patient with chronic obstructive airway disease. This will lead on to systemic inflammatory response, can lead to fluid retention and exacerbation of heart failure. Prompt diagnosis and management of infection, especially respiratory, urinary tract and skin infection, is essential. So there is a multitude of ways in which infection can precipitate heart failure. Among the other infections, urinary tract infection is the most important thing. This can trigger systemic inflammation and exacerbate the heart failure. Next, non-compliance with pharmacological treatment. A patient with heart failure due to hypertension may be on treatment with antihypertensive, discontinuation of medications. Patient may be on diuretics, discontinuation of diuretics. Like that, non-compliance should be always investigated and asked for in patients with a chronic heart disease. Chronic heart failure comes with worsening of symptoms. Along with the non-compliance, intake of drugs associated with heart failure decompensation is also there. There are innumerable drugs that can precipitate heart failure. The common examples are non-steroidal anti-inflammatory drugs, that is COX-2 inhibitor, many anti-cancer drugs, doxorubicin, daunorubicin, cyclophosphamide, all these can produce. Monoclonal antibodies, Calcium channel blockers, again like verapamil, nifedipine, diltiazem. Antidepressants, especially tricyclic antidepressants. Beta blockers. Even the beta blockers can be used for heart failure. Sometimes inappropriate dose can lead on to worsening of heart failure. Potassium channel activities like diazoxide. So, whenever a patient comes with heart failure, check the medications, including over the counter. Any cardiac symptoms can be worsened by anemia because the oxygen carrying capacity is by the hemoglobin. When the hemoglobin is decreased, the oxygen to various tissues, including heart, comes down. So anemia and the various causes of anemia is especially very important to look for. Patient may be on aspirin, clopidogrel. This can produce GA bleed and also can produce anemia due to blood loss. So remember anemia. Always think of thyroid, hyperthyroidism, either due to development of arrhythmias or hyperthyroidism itself increases the metabolism and can lead on to heart failure or precipitate heart failure. Not the last, but remember dietary problems. Excessive use of sodium. This will produce fluid retention. Excessive fluid intake, that's more than 2.5 liters per day. So education regarding sodium restriction and fluid management is very important, especially in patients with heart failure and excess fluid retention or patients with edema. So close monitoring and counseling is essential. Refrain from alcohol, manage fluid intake, avoid fatty food, and remove the skin from the poultry, consume more of fish and vegetable proteins, reduce fat and cholesterol, eat lot of or more of fresh fruits and vegetables, and more important or most important, restrict the sodium. That is, salt should be restricted, curtailed. Then in a reproductive age group, pregnancy. So patients with valvular heart disease or cardiomyopathy, they may come, or the heart failure can be precipitated by pregnancy. There are other precipitating factors like worsening of renal function. For somebody with a hypertension, they can have worsening renal function, or somebody has a diabetes. Worsening of the renal function can precipitate. So prompt recognition of other conditions is essential. So kidney is very important because there is a crosstalk between kidney and cardiovascular system. So hemodynamic abnormalities can produce renal dysfunction. This may activate the renin-angiotensin system. For example, when there is a renal ischemia, sympathetic stimulation occurs, renal perfusion comes down. This can produce stimulation of the renin-angiotensin aldosterone system. The renal failure can worsen anemia because of the reduction in the erythropoietin production. So multifactorial. So renal failure is an important point to be considered. Heart failure can lead on to renal failure. Renal failure can worsen heart failure. So two ways. So in summary, we have discussed the major points. Precipitating factors for heart failure: excessive salt and water intake, non-compliance of medications, inappropriate use of certain drugs, arrhythmias, ischemia, fever and infections, alcohol use, and of course pregnancy in young people of the reproductive age group females. The next session we'll be discussing about the management of heart failure. Thank you.